Hi, thank you for joining me today on this talk for Digital Leaders Public Sector Insights Week. I am Dr. Jayne Rodgers from Teesside University, and I'm going to be talking to you today about the digital dimensions of research collaboration in tackling health inequalities, an ecosystem approach in the South Tees region. This is a project that is bringing Teesside University, two local authorities and local communities together. I'm going to talk to you about how the project came about, the rationale for it, and what the plans are. Now, we are in the development stage of this project at the moment, so I'd be very keen as we go through the presentation to hear any comments, tips, thoughts on your own experiences of working on similar projects. So if you could put those in the comments box below, that would be great. I can get back to you and we can have those discussions. So let me explain who we are. I'm speaking on behalf of the university today, Teesside University, and we're working in collaboration, as I say, with two local authorities, that is Middlesbrough and Redcar and Cleveland. Redcar and Cleveland is one authority. So those two local authorities, Teesside University and the local communities, which I'll tell you more about in a few minutes. The people working mainly on this from Teesside University and collaboration with other colleagues are Professor Dorothy Newbury-Birch, who is a professor of alcohol and public health. She has extensive experience of working on public health issues with local communities and in co-produced projects of this kind. Dr. Andrew Divers is a research associate who works in the School of Social Sciences, Humanities and Law, and he has a lot of experience of working with communities, with local authorities, and he is pulling together the multiple stakeholders involved in this project. And then I'm Dr. Jayne Rodgers. I'm a senior lecturer in digital marketing and digital business at the university, and my role within this project is pulling together the digital dimensions of it. And again, I'll tell you more about this as we go along through this presentation. But as the project comes together, we need a digital platform and a digital presence. And that's what I'm going to talk about here. So let me explain the health determinants research collaborations. It's a little bit of a mouthful, but we call them HDRCs more commonly. It just makes it easier. They're a new element of NIHR funded research. For anyone who doesn't know, NIHR is the National Institute for Health Research. Each of these projects is worth up to £5 million over 5 years. And there have been 13 of these projects funded across England from October 2022. This South Tees project has 6 years because we have this extra development year for it. They're based in local government, and the idea is to enable local authorities to become more research active so that they can use evidence to inform decision making, including synthesizing and mobilizing evidence. So what we're looking for through this project is to help develop the foundations for research and allowing people who work within local authorities and people within local communities to collaborate with academics and others to do research, and also to develop the skills to do additional research bids and develop additional research resources. The aim ultimately is for South Tees to become an international beacon for research and innovation by tackling poor health outcomes and inequalities. And we talk about it as an international beacon for research and innovation because there really isn't a project of this kind conceived in quite the same way in existence. This is a new way of approaching a co-produced research collaboration, and I will explain that in more detail as we go along through the presentation. to highlight some of the issues that we're facing here, there's information about health inequalities in the South Tees area, in the local authorities that we're looking at. So you'll see here this URL. This data comes from Public Health England, and this fingertips.phe.org.uk URL provides huge amounts of data on health inequalities in different areas of England. They're very useful, and you can find information about your own local authority here as well if you just do a search in the box there. But these are the things, and this is only a sample of them, that we see in the South Tees area. So in the South Tees area, we have these examples of higher than England averages, age 18 plus, overweight or obese, aged under 75 mortality rate from causes considered preventable. We have higher than England average smoking prevalence, and aged under 75 death or mortality rates from cardiovascular disease, from cancer, and from liver disease, among other things. This is by no means an exhaustive list. So these are the type of health inequalities that we're dealing with, and trying to develop a research ecosystem that is helping us to cross-reference information, gather new data, and make use of existing data to try and find ways of addressing these issues. So the research and data issues that we're looking at with this, we're looking first at access to and use of data. So where is the data? Who has it? And how is it being used? Who can access it? One of the key issues that we'll find, and many of you who have worked on data issues before will know, that there is a huge amount of routinely collected data that is not being accessed and not being used in a useful way. So it's gathered. Every interaction that a public authority has with the public has data recorded from it, it's stored, and then it's not being used. And what we find in this situation is that from a local authority's point of view, there's often a lack of resources to get at the data and use it. A lot of issues with trying to share the data, but getting hold of the data in the first place. What are we going to do with it? There's data there, don't know what to do with it. And then there's also a lack of training through, that in itself isn't an issue. People are doing their jobs, that's what they're there to do. But then there's a lack of training around how to make best use of the data that is perhaps available. For academics, there's a lack of access to data. So this tends often to be done on a very ad hoc basis. So if, for example, one of my colleagues is doing research on smoking prevalence and its cultural dimensions, they need to know someone who has access to that data, who is able to provide a conversation with them. So it's often done on an ad hoc basis, and we're trying to create a more transparent and open system for accessing this kind of data. And then, of course, we need to develop data sharing agreements, which are necessary for bringing some of this data into the public domain. Now, all of the data that we're talking about here is anonymized data. It's just about trying to make that data accessible in some way. So this ecosystem approach, and we include communities in this, and I will talk more about this on in future slides along this presentation, is about developing this ecosystem that is going to allow all of these bits to come together and make sense. So who's involved? So the local authorities, Redcar and Cleveland and Middlesbrough, are the two local authorities that we're working with on this project. Teesside University academics. Now, our scoping work for this HDRC project showed that there was often within communities a lack of connection to universities. Researchers generally aren't part of a community, and an increase in co-produced research over time is lessening these divisions, but they do still exist. So the next dimension is to add in communities to this research ecosystem to get them involved in doing the research and co-producing research with us and with the local authorities. And then beyond that, we're looking towards developing community-based researchers as well. So these are people who will be based within communities, the communities that we're working with, who are able to discuss with the communities that they work with the type of research that they would like to see undertaken. And they'd be linked to the university, they would be working in paid posts, suggesting research projects that could be supported by academics and by the local authority. And this is important because this strand of research is community-led and is seen by communities to be relevant to communities. And the ecosystem, if we take a dictionary definition of ecosystem, is about complex and interconnected networks. And when we look at who's involved in this, the type of research that could be done, and what our potential definitions of research as well are, we can see this complexity and interconnectedness across. So again, if you have any questions about this, just pop them in the comments below. Any comments you'd like to make, because I'd really like to encourage further conversation around how this develops. Now, if we look towards these digital dimensions, how do we make this digital? What happens at the moment is the data that we have access to is generally used on a case-by-case basis, and it doesn't always make the most of opportunities to research or analyse or cross-reference data. So data may be held in one department that isn't visible to others, they may not be aware of it. As I mentioned, academics would often like to access data that they don't know exists or they don't know how to track down. So there's lots of data sitting there that isn't being fully utilized. And this is a common problem that has emerged with the evolution of digital recording systems, that we gather information and then we're just not using it. So, we have these massive amounts of data that are not being effectively utilized. And what we're doing with this project is developing a form of data repository for them. So what we're looking towards is a shared space that all of the stakeholders I mentioned can access. And this would include not just people in this region, but also people in other areas. So other academics, other universities, other local authorities, other communities. So we're trying to create this shared space that all stakeholders can access. This is primarily about this region, but the data will be accessible to everybody, and the system will be accessible to everybody. What we're looking for here is a project that aims to create a visible space for data sharing, academic research, and community engagement, all in the same place, to share data, generating intelligence, share this the intelligence that is found in turn, and then in turn generating new data. So we develop this virtuous circle system where data is being used, is being analysed, new research is being conducted, and then new research is being conducted from that. So we get a shared space where all stakeholders can access. In this space, raw data can be shared and accessed. So as I say, it's all anonymized data from interactions with the public that will be shared in this space. In the space, all stakeholders will be able to share and access reports. So if someone accesses some of this data, takes it, uses it, produces a piece of research from it, so writes a research paper, creates an infographic, writes a briefing paper, that in turn will be shared in this space. And then that can be accessed in turn. So again, we're building the ecosystem. So we're building from what we already have, but we're also expecting it to expand and stretch as we go along. We're looking at the idea that we need to be mindful of digital exclusions and making sure that the space is accessible. So that's one thing that we're trying to build in as we develop this. So if you have any comments or experience of doing this, it would be great if you could pop this in the box below so that we can have conversations about that too, because we're looking at multiple stakeholders here, and making sure that this system works for everyone is an issue that we want to make sure that we address. Related to that is the idea that this is complex and multifaceted. I'm sure that you recognize as I speak here, there are lots of different dimensions to this that we need to take into account: different stakeholders, different places that research comes from, different types of reports and so on. And we need to make sure that we're producing a simplified and kind of easy to access system. Within the system, we will also be including a moderated discussion space. So we want to make sure that people can have conversations in this too. The way that we're envisaging this is a portal, and I'm putting the portal in inverted commas there, because portal always comes across as the idea that this is kind of locked behind something. You know, it's not, this isn't necessarily a password protected space. This is an open space. It will essentially look like a website, but it will be fairly easy to use and fairly well structured. So within this portal, in inverted commas, local authorities can upload data, any data that they have that they think could be used for research, then they can upload that there. It's all anonymized, as we discussed. So it's anonymized records of interactions with the public. That's the type of data that we would expect to go up there. In turn, that will be available to local authorities, to academics and communities. That data that goes up there can be used by academics for analysis. It could be used as secondary data in, say, large-scale research collaborations. So if we were to develop a project with another university or a group of communities, a group of stakeholders, then some of that research could be pulled out as primary research, as secondary research to underpin a new primary research project. We'd also have projects led by community-based researchers, and this is an important dimension of the research ecosystem, that community-based researchers are best placed to identify issues that are affecting their communities in many cases. So community-based researchers supported by the university could in turn decide that they would like to conduct research around a particular topic affecting a particular community, and the university would help to support that research. And the research that is then conducted either by academics, by community-based researchers, and or in collaboration with local authorities would in turn then be shared by academics and community-based researchers in the portal. So you get this linking of what they take out, what they put back in, what in turn can then be used from that. And we would also have in there this chat space for discussion where people could propose new research, and they could ask questions and they could seek advice. So we have this moderated space where people would be able to discuss the type of research that they want to undertake. The types of things that we're looking at can cover a vast range of issues. Anyone who has worked with local authorities will know the vast amount of information that is held there. We're looking specifically at health inequalities through this project. So the types of data that we were looking at, and again, this is not necessarily exhaustive, but there is population level data, all kinds of different demographics, all kinds of different income levels, and so on. All of that level of data, things like alcohol and drug use, vaccination rates, sexual health, mortality rates, pregnancy, perinatal and neonatal data, child health information. All of this information is gathered and is not being fully utilized. So that's the research ecosystem that we're trying to create. There are lots of other types of data that are being collected too. What we're hoping for is that this data can be shared through this space, and that helps to develop this research ecosystem. Within the system too, there'll also be support for training people who work within the local authority to help make the most of this data, particularly around cross-referencing it. That is the project in a nutshell. So I'd just like to say thank you for listening. It's a big project with a lot of money behind it that we are in the process of putting together. As I distilled it there, you can see it's coming together pretty well. But if you have any questions about what we're doing it and how we're doing it, and any comments, and please any experience that you have of working on a project like this, would be really grateful to hear about it. So please post your comments in the box below, and if you are interested in further discussing the project, developing projects like this in your own area, do please mention that in the comments, or do feel free to drop me an email at j.rodgers@tees.ac.uk. It's been an absolute pleasure talking to you. Thank you for joining me.